So now it's my pleasure to introduce our plenary speaker, who's going to give the keynote address. I hope Professor Ashiru Oredope will forgive my inevitable mispronunciation. No, it was okay, was it? So I want to introduce Diane. So she began her career as a hospital pharmacist, is that correct? Later doing a PhD at UCL, and is now the lead pharmacist at UK HSA, as well as being deputy chief of the Royal Pharmaceutical Society. So it's a great pleasure to introduce you. I think you're ready to go. And you can use this if you like, or those ones.
That's very good presentation. Thank you. Okay, hopefully you can hear me. So around 2010, 2011, I was watching a documentary of a young girl about 8 years old. She was very active, had a little scratch. A few days later, she ended up in hospital. By the time she finished, or by the time she came out of the hospital, 5 months later, she was in a wheelchair and had double lung transplant. So 2010, I was a hospital pharmacist. Before that, as has been mentioned, that petrified me because I was also a mum. At that point was when I realized that tackling AMR was more than a job for me and has become a cause that I've done, and I'm really grateful for the opportunity to do that. Today I'm going to be talking to you about antimicrobial stewardship. So slightly different, but it was great to see the talk earlier from Tess around the ethics approaches and ethical considerations, and I will admit that we do use those cohesive approaches, and some of that has been mentioned also by Dr. Patel earlier, but it's making me reflect in a different way. But what I wanted to also share is that every single one of us, right from the lab all the way to policy, have an important impact that we are making, and I hope that you will continue to do that. And also that even the lab work that you're doing is really important evidence that can help translate and change policy. So also don't forget that. So today, I'm so grateful actually that Jay's talk came before mine, because he talked about the global. I had the global information on my talk and then I took it out. And I'm going to focus on the national actions. I will mention a couple of bits around global over time. So I'll talk to you about our actions within the UK. It was great. I talked about liking the study that they did and where UK was, and he's right. Although we were number 3, we still want to be number 1. But even then, there's always something that we can do to be better, because at the end of the day, this is about the patients and the population, and all of us, including myself, could be patients one day with infections. Okay, so in terms of what we've done within the UK, actually, we have been working on having a national action plan since 2011. Our first documentation was in 2011, and then 2013, 2018, and we're currently within a national action plan 2019 to 2024, which ends this year, and a new one is being published in the next few months. But within that, you can see that there's a multidisciplinary approach that is required around being a good global partner. So this is what we want to do in the UK. Provide safe and effective care for patients, minimizing infections, demonstrating appropriate use of antimicrobials, engaging the public on AMR, sustainable supply and access, minimizing the environmental spread. So across human and animal health. We have a proactive surveillance process across all 4 UK nations. Health is devolved, so each nation has its own surveillance program. And I work in one of the institutes, UK HSA. We work Public Health England, and we focus on England's surveillance program. I chair the ESPAR Oversight Group, which is the English Surveillance Program for Antimicrobial Utilization and Resistance. And within that, every year, we put out the national status around our surveillance data for antimicrobial resistance, antimicrobial use and consumption, stewardship, and then implementation of awareness activities. And you can see there the chapters that we have within the report, which gives you an insight into the sort of areas that we cover within the national report. Although it's a surveillance report, we also talk about their stewardship. And then within the report, we will report on the burden of infections. So we know that the burden of infections has remained broadly stable. And during COVID, we had a slight decrease. We have concerns now that this is, as we've returned back to our usual approaches and health-seeking activities and the health system is going back to what it was pre-COVID. We are beginning to see increases again across infections, across resistant levels as well. But one thing that is important to highlight here is that 30-day all-cause mortality. And you can see there that when a patient has a resistant infection, what proportion of them will die as a result of the resistant infection. We also have data on consumption, and you can see there again that we've had reductions in antimicrobial consumption. Part of that was actually the concerted effort to having a national program. So someone talked about, should there be international scrutiny or should there be national scrutiny? One of the key things was that we were looking at our data when we were part of the EU and looking at where we were across the EU, and we saw that our antimicrobial use was similar levels to certain countries, and that meant that we needed to take further action. And so part of that was developing this surveillance program, which has helped us because it's catalyzed action across multiple organizations. Majority of the prescribing does happen in primary care, but we know that most of the broad spectrum use happens in secondary care. Again, the data, you can see the primary care data there with the reductions, and you can see dental, other community use, and primary care. But in secondary care, again, we had some reduction during COVID, but that's going back up again. So really what we are now thinking is, what further actions do we need to take to ensure that we don't have continued increase in antimicrobial use, which we'll know will impact on resistance level over time. We don't only focus on antibiotics. For many years, we had a strong focus on antibiotics only, but over time we are reporting on antifungals, we also report on antiparasitics, and we report on antivirals as well. So what is antimicrobial stewardship? It is defined, and this is a nice definition, I think it's a good one to use, organizational and healthcare system-wide approach to promoting and monitoring judicious use of antimicrobials to preserve their future effectiveness. There is that part which is around the systems approach, but there's also the individual level. So each person has a stewardship action that they can take on around antimicrobial use, healthcare professionals, members of the public as well, and everybody does have a role. So here are some of the levers that we have, and I say this to you, I know many of you work within the labs and think, how does this impact on me? But actually it is good for you to understand these policy implications and why your research matters. And if you're also submitting for grant applications, it helps to be able to link it to something that is in the national policy. So within the Health and Social Care Act, there is a code of practice on preventing infection, control of infections, and there's a strong, there are two criteria there around antimicrobial use and stewardship, and also having that there is policy for ensuring that people have or at risk of developing infections are promptly identified and receive appropriate treatment. Targets. So Jay talked about wanting a target at a global level. Good luck. But from within the UK, we've had targets, and actually, we had targets. There's always been a discussion: do you call them targets? Do you call them something else? Ambitions. I think these were actually called ambitions, but in reality, we have a goal. We have numbers that we want to try and get to, and that's really helped us to focus attention over the years. Sometimes we don't get to those targets and we may not meet the targets, but actually what it does is it galvanizes action across multiple organizations for us to get towards those targets. And we have one specifically on antimicrobial use, but you can see there's also a target or ambition focused on food-producing animals, antibiotic use in food-producing animals. Interestingly, the animal health sector have done much, much better than the human health sector around the targets. Different organizations will also take actions. The NHS England have improvement and assurance schemes, which is linked to that cohesive approach, where basically they, NHS Trust have a standard contract, and they need to try and reduce the antimicrobial use or have metrics and targets that they're measured against. So I just want to talk to you very briefly about some stewardship interventions we have, and I would encourage you here not to try and listen to remember all of them because these slides will be available to you. The key organisation in England is UKHSA that I work with, and then NHS England. Scotland, Wales and Northern Ireland also have their equivalent bodies, and obviously Royal College's professional bodies, health and education institutions also lead on this. What are the key things we're trying to achieve with antimicrobial stewardship? We want to reduce the need for antimicrobials in the first instance, so preventing it through infection prevention, so vaccination, for example. We want to reduce exposure, so that is even if you are treating a patient, can you treat them for the shortest possible time? And can you make sure that you're giving them the appropriate treatment in the first instance? And then you optimize if you are going to give an antimicrobial, or if you need to manage the infection, make sure that you're using evidence-based approaches for that. We do use behavior change strategies across our national stewardship interventions that we develop, and we use the COMBI model most often for that, and capability, motivation, and opportunity. I won't have time to go into that, but I think it's a good one that I encourage you to have a think about if you are interested in developing interventions. NICE have guidelines, and these are really important. So again, if you're within developing or working within the lab, actually if you're focusing on particular organisms or particular antimicrobials, where does that fit within the health system and within guidelines? That may help you in seeing how your projects may be used further down the line. And then there are tools available for those in primary care, but also in community pharmacy. Many of you would have heard now that it's possible to go to the pharmacy and have an infection and have it appropriately managed by the pharmacist. Sometimes that will involve giving antibiotics, but sometimes they will not give antibiotics, but they've had significant training to make sure that they have those stewardship principles. And then within secondary care as well, we have toolkits within that as well. And then just very quickly around public surveys. We know, and I know that INEOS have done some work around public work, and I really am encouraging the colleagues who've led on that to really think about publishing that and sharing that, because I think it's really important that we have the information about the knowledge and attitudes of members of the public in tackling antimicrobial resistance. We use a range of approaches to talk to members of the public. We have the Antibiotic Guardian campaign, which is a pledge-based approach, so again using behavior change strategy. And through that, we now have more than 200,000 pledges across 120 countries where people have chosen about what they can personally do to help tackle antimicrobial resistance. We also have the eBug resources for children and for young people and those in school-age children. Again, the resources are good. So if you're involved in any public engagement activities or community work, that's a good resource to use. I'm just going to very quickly talk about the antibiotic subscription model. I think it links back to the economic cases, but also the fact that pharmaceutical companies, when we have new antimicrobials, we want to save them. So actually there is that challenge around the economic impact on them. But now we have a subscription model within the UK, which allows for, which is encouraging pharmaceutical companies to develop new antimicrobials and to still be funded for those antimicrobials, even if they're not going to be freely available or easily accessible in terms of being able to make sure that they are reserved for resistant infections. We have challenges with outbreaks, so many of you will know around this, the Strep A, Group A outbreak that we had last year, and the challenges that has on antimicrobial use as well. And this is my last slides around health inequalities. I think this is a really important consideration that we need to have. We've been doing quite a lot now to make sure that all our data, we publish them based on the factors commonly associated with health inequalities, particularly ethnicity, deprivation, age group, and sex, and then geographical data as well. What we know is that the burden of infections has not changed since 2018, but what we are seeing though now is a widening gap, particularly for ethnicity and IMD, in the rates of resistant infections. And so now the question is, what interventions do we need to put in place to make sure that we don't continue to see those widening gaps? And around data, there's a wealth of data available. So if you ever need to look at data, to use data and understand what what's the national picture around resistance or antimicrobial use, I would recommend the Fingertips platform that's openly accessible. Anyone in the world can go on there and find their GP or find their local area. You can go and find what's the resistance levels within Oxford, or what's the antimicrobial use within the different ICBs or ICSs within Oxford, for example. So in closing, there is a need for diverse and engaged approaches across the research disciplines and healthcare infrastructure to combat antimicrobial resistance. Really want to encourage you all to continue to do the work that you are doing. In the future, the actions are required across several areas, and I'm going to leave this slide here because it shows you a range of areas that will also feature in the next national action plan that will be published. Thank you.